Now to the perspective of people who have had COVID or have recovered from the virus. Glad you can be with us tonight. Hello, I'm Brad Bird.
And I'm Shelley Kirk. Every night you hear the number of new COVID-19 cases reported by local health departments. Tonight, some of those directly impacted by the disease talk about the impact it's had on their lives. Eyewitness News' Mike Pickett has more with two tri-staters on how it's affected them.
My symptoms kind of started on Tuesday. I woke up with a migraine.
Ashley Alaga started experiencing the physical symptoms last week. Several days later, a test confirmed she had COVID-19.
I was trying not to get in my head and think that I had it. The longer that the time went on, I was convinced that I had it because I wasn't getting any better.
Alaga says having to quarantine in her bedroom, physically distant from her family, has been as tough as the physical symptoms she's experienced.
And I started to get a little bit emotional about being away from my kids and not being able to go downstairs while I'm hearing them laugh and play. That's been pretty tough.
But there's a lot of emotional toll it takes on other people as well.
Owensboro Dr. Jeremy Luckett has firsthand knowledge of what the virus does through his patients, and when he tested positive in April,
I did not have a lot of symptoms at that time, a little bit of chest tightness and a little bit of shortness of breath.
And last month,
this time I was much more symptomatic, had a lot more cough, a lot more shortness of breath, didn't really have much fever.
He says the virus can also emotionally impact those who've never had it.
Even folks that have not had to experience the illness themselves, there's a whole lot more depression, anxiety, all the rest of that going on. Particularly a lot of my older patients that are very afraid to get out.
In Owensboro, Mike Pickett, Eyewitness News.